Hello, Chad Moses, physical therapist with Cary Orthopaedics. Today in the patient education series, we're going to be discussing probably our most widely used modality across all our clinics and clinicians, and that would be instrument-assisted soft tissue mobilization, or iastm for short. So instrument-assisted soft tissue mobilization is a manual technique that uses a stainless steel instrument to diagnose and identify an array of acute and chronic soft tissue injuries and dysfunction. The history of instrument-assisted soft tissue mobilization dates back 2,000 years ago to traditional Chinese medicine with a technique called gua sha, which literally means scraping. Practitioners would take pieces of jade or stone and they would scrape a person's skin until it turned really red or even bruised. This was with the intent to help with muscle injuries, increase blood flow to the areas, and help with cell regeneration, growth, and repair. So today's instruments are made from a dense stainless steel. So as you take the instrument and you go across the tissue, any abnormality in tissue texture will be amplified through the instrument into our hands. So then at that point, we can use the tools diagnostically to identify any areas of restriction, fibrosis, or scar tissue. And then once those areas are identified, we can use different shaped tools to kind of manipulate the soft tissue. The goal is to cause microtrauma in the area to stimulate an inflammatory response. And then once that happens, the body can properly start to heal itself in a controlled manner. Essentially, the tools are extensions of our hands. They allow us to feel things we may not normally be able to, similar to dry needling. From a patient perspective, it allows us to be very specific and localized, and we can treat a specific area in a shorter time period compared to other manual therapies of the past. From a therapist standpoint, it really saves on our hands from having to do a lifetime of manual work. There are many different types of tools in the market today. The common theme is being made of stainless steel and having either a single or a double beveled edge. And what this allows is we can work from superficial to deep or be more or less aggressive with the instrument. The sizes of the tools also dictate whether we treat a smaller body part or a larger body part. And then part of it is just therapist and patient preference. As always, thanks for watching and enjoy the demonstrations.
In a healthy individual, muscles and fascia are able to slide and glide without restriction. However, after an injury, fibroblasts lay down more collagen and increase the fascial density, creating adhesions, which can be referred to as scar tissue, which limits the function and the range of motion of muscles, joints, and other tissues in the region. iastm can break up these adhesions by using the beveled edges that can pull, stretch, and release fascial tissues. This improves blood flow, stimulates the neurological pathways and reflexes that affect muscle tone and mobility. This mechanical stimulation promotes optimal healing and function. For most patients, near the end of the session, they will develop some redness or petechiae, which are red purple dots on the skin. This is a result of causing microtrauma to the capillary beds to allow blood to escape the vessels and pull into the surrounding tissues to promote the healing process. You can get some mild ecchymosis, which is bruising, which is the same as petechiae, but on a larger scale. A typical session of iastm involves warming up the tissue, either passively or actively, then scanning the soft tissue in question to identify any dysfunctions within the muscle or the fascia. Once identified, there are various strokes that can be used to manipulate the tissue. As an adjunct to iastm, we may perform joint mobilizations and stretches to improve a patient's mobility, then introduce strengthening exercises to build the resilience of the muscle tissue.